Two COVID-19 tests totaling nearly $4,000 for one Austin family. Our KXAN investigator Kelly Wiley found something free in many places can end up costing you and your insurance company thousands elsewhere.
You know, at this point...
Back in September, Suli Luque and her husband wanted to get away. They decided to hike the Inca Trail to Machu Picchu. Like many Americans, before jetting off, they needed a negative COVID-19 test. So they made an appointment at the Riverside Austin Emergency Center, one of the many freestanding emergency rooms in Texas. But when she returned to Austin, she and her husband had a letter in the mail from their insurance company. It said the service they got was not covered under their insurance and that they were responsible for nearly $2,000 per test.
$4,000 altogether.
For you to get
out
a
of my
COVID
pocket
test.
to get a COVID test. And like I'm telling you, nothing more than just them sticking that thing up my nose, and it did not take more than a few minutes for them to do that.
Shell-shocked, Suli first called her insurance. Then she called the Austin Emergency Center.
I'm just really angry at them because I'm going like, do they take advantage of things like this all the time? Do they try to get as much money as they can out of everything they do?
In cases like Suli's, Austin Emergency Center tells us when it sends a COVID care claim to insurance companies, it includes not only the price of the test, but additional charges. Things like a lab charge, an ER visit charge, and even a physician's charge. That bill that Suli got was actually an explanation of benefits from her insurance company, basically telling her they have no intention of covering anything but the COVID test itself. So where does that leave Suli? Austin Emergency Center says it will accept the insurance payment in full and not bill Suli for any of the charges her insurance company refuses to cover. Ashley Pierce with the Texas Association of Health Plans says what happened to Suli is happening all across the state with many freestanding ERs in Texas.
They're trying to pass along these costs to health plans and insurance companies to see what they can get for it.
The risk to Suli is not just a scary-looking piece of mail, though. Pierce says, gone unchallenged, Suli's premium could have gone up later, or she might have had to pay for what should have been a free COVID test.
You should definitely communicate with your insurance company to make sure they know that what is on this bill is not consistent with the service you received.
We also spoke with the Kaiser Family Foundation about why these tests can cost so much. They say generally insurers have to pay for your COVID test, but there are some loopholes where they can say we're not paying. Usually it's when a test is not medically necessary. That can mean it's a work requirement or for travel. In those cases, they say to look for free testing, which we know can be challenging, especially around the holidays. They also recommend checking the prices posted online for these medical clinics and also avoiding freestanding emergency rooms where you can to avoid those extra charges. In the newsroom, Kelly Wiley, KXAN Investigates.
Kelly, thank you. And we spoke with the Texas Association of Freestanding Emergency Centers, which represents many such sites across the state, but does not include the Austin Emergency Center. And the group says it strongly condemns the practice of excessive billing fees for COVID-19 testing, adding when there is an extreme strain on our healthcare system, patients must remember freestanding emergency centers are not testing sites. It says the Omicron variant, while less severe, is more contagious, causing a drastic increase in the number of patients our ERs are treating. We recommend those who are only seeking a test with no symptoms of illness to go to a testing site, find an at-home test, or set up an appointment with the primary care facility rather than visiting an emergency center. This story started with a viewer tip. If you have something you think our team should look into, email us at reported@kxan.com or scan the QR code on your screen with your cell phone right now.